We are continuing our Mental Health Monday segments. In May this morning, we're talking to experts about prioritizing your health and finding positive treatments. Let's check in now at 7 News' Christine Scarpelli. She's live in Greenville with doctors at PRISMA Health. Good morning, Christine.
Good morning. That's right. Yeah, with those doctors this morning talking about the steps you can take to find a way to feel better, right? If you're going through some anxiety, some depression, and you're looking for maybe the first step, how do I seek help? Well, Dr. Asa Briggs here to tell us a little bit more. PRISMA Health this morning, talking to you, doctor, about maybe how we start. We're having those feelings, we're anxious, maybe a little depressed, but that's not always an easy thing to admit. But it's good to have a good relationship with who? It sounds like a primary care physician.
Your primary care provider, because most oftentimes with the patients, the primary care provider is the first touch for that patient. And so when we think about anxiety, depression, we have some screening tools that the patient can access through their primary care doctor, and it's the Patient Healthcare Questionnaire 2 or 9. And so we just basically ask that patient, how are you doing?
Okay.
Are you feeling hopeless? Are you feeling suicidal maybe? Are you spending a lot of time in bed, not doing your normal activities?
Important to be honest with these questions, right?
Absolutely.
Why
because
is that?
if you're honest with your primary care provider, then they can give you, those tools are not diagnostic, right? So, but that helps to build sort of a clinical picture for that patient. So that in the event that we need to escalate to a specialty provider like myself, your primary care provider is going to be able to provide me with that collateral information. Fantastic. So that when I meet you for the first time, I've kind of heard a little bit about your story, and that's called like a warm handoff. And so like you talked about, it could be anxiety provoking, it can be depressive, and so you can be also afraid to talk to somebody new. And so having that relationship with your PCP, then that carries over to me as a specialty provider. That helps with bridging that gap in terms of connecting you with the provider.
And viewers, listen, many of you have reached out to me and said, look, it's hard to find a therapist, a counselor, someone to speak to. There are waiting lists that are months long. Well, get on that list, but a better way to do it might be just to, again, tell your primary care provider, and they can contact somebody like Dr. Briggs here, who can actually get to the bottom of the issue even faster. Coming up, we're going to talk a little bit about the medicine of mental health, talking about different diagnoses, and then kind of how to treat some of those with medicine without. Guys, on screen is how you can take that first step, prismahealth.org, finding a primary care physician, or even the next step, and then Psychology Today for just a little more on who to talk to. Guys, much more after this. We'll see you soon.
All right, very important conversation that we're having. Thanks so much, Christine. Appreciate it. Brett?
Coming up on Carolina Morning, clean your room. It's not an order from your mom or dad, it's a national day.